Peru News Today, all you need to know about Peru. Peru enables containment procedures to prevent Zika epidemic. Read about how Peru's health ministry plans to contain the Zika virus after discovering new indigenous cases. Upon identifying indigenous cases of the Zika virus, Peru's Ministry of Health MINSA activated quarantine-like procedures, Cerco Epidemico, to prevent a national epidemic from occurring. The Cerco Epidemico has helped the health ministry officials to identify new indigenous cases of Zika. Previously unknown autochthonous cases of Zika were discovered in Yurmaguas, Loreto, Jaayacuden, Cajamarca, Pucallpa, Ucayali, Zarumilla, Tumbes. That brings the national count of Zika cases to 29. 12 imported and 17 indigenous. The international cases were brought into the country from Colombia, 3. Ecuador, 3, Venezuela, 3, Brazil, 2, and Bolivia, 1. Indigenous cases are isolated to a few areas. Jaayacuden, 9. Yurmaguas, 4. Zarumilla, 2. Pucallpa, 1, and Lima, 1. Sexually transmitted. And health ministry officials would like to keep it from spreading elsewhere. As a result of the newly detected Zika cases, the health ministry deployed multidisciplinary teams for technical assistance and support to each of the contaminated regions. In addition to sending multidisciplinary teams to each region, the health ministry approved investigation, case tracking, focal control, and the fumigation of 56,000 homes. Furthermore, they implemented preventative measures to inhibit sexual transmission of the virus. The health ministry has transferred 27,645,832 sols worth of budgets to the most high-risk regions of the country. The increased funding will serve to intensify disease control and prevention standards. Local governments are being urged to put all of the additional funds towards the health emergency, because the funds will stop on June 17. In coordination with the National Center for Epidemiology, Prevention and Disease Control, the health ministry will permanently evaluate the epidemic situation in Peru. Subsequently, the health ministry will facilitate the distribution of ovitraps. Traps designed to mimic the natural breeding site of Aedes aegypti mosquito, the mosquito that carries Zika, collecting samples from pregnant women, and other measures designed to monitor the asymptomatic population near detected Zika cases. Visit at www.perunewstoday.com. Also follow on Facebook and Twitter.